This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning, welcome into the program. I'm Dave Wilson. We have two in-studio guests for this morning's show, Dr. Gregory Nelkamp. Good morning, Dr. Nelkamp.
Good morning.
And an old pro at this show, and I can't believe she actually came back, Dr. Archana Vasudevan. Good morning, Dr. V.
Good morning. How are you?
I'm just going to go Dr. V the rest of the show because I probably won't get your name right the rest of the show. Did I do okay that time?
Sounds great.
All right. Hey, guys, we appreciate you coming in. We got a lot to try to cover here over the next 30 minutes or so. Of course, you have been living under a rock the last few weeks to have not heard about coronavirus. So we're going to talk about it. What is it? What is COVID-19? Are there different strands of coronavirus? What happens if I get coronavirus? Is it time to panic and go buy, apparently toilet paper seems to be the thing everybody wants to buy at Walmart. Different story for another show. So with all that being said, before we jump into the subject at hand, Dr. Nelkamp, your first time in, so let's learn a little bit about you. Where are you from? How'd you end up at Mon Health? Tell us about yourself.
Well, I'm actually from Cincinnati, Ohio. Had the privilege of being Chief Medical Officer out west, but was very excited to come to Morgantown and join the Mon Health system. I have family in the region and just wanted to get back home.
Are you enjoying it here? Happy to be back?
Very happy to be back. Mon Health is an excellent system. Well,
we're happy to have you in studio this morning. Of course, Dr. V, you've been in a couple of times with us. We know all about your credentials. So I want to cover as much as we possibly can today, so let's jump right in. Dr. V, what is COVID-19? What is coronavirus? I don't even know what this is, and we've been talking about it for months now, it seems like.
So coronaviruses are a big group of viruses, and COVID-19, which is the virus that's causing the current outbreak, is one of the group. And it's currently being called severe acute respiratory syndrome COVID-2 because we've had similar outbreaks in the past from other coronaviruses like SARS and MERS. And these also have been infections that have jumped from animals to humans. Currently, this one started in December 2019 in China and spread globally. And the numbers are currently rising within the United States as well.
What's the big deal? What makes this such a concern for healthcare providers?
It is just that this virus has been really very contagious. Out of the case reports that have come from China and South Korea, and the data we have is limited because this is such a new virus, about 16% of the patients go on to have more severe symptoms. Most people, about 80% of the patients who get it, recover pretty well. But about 16% go on to have more severe infections with severe breathing problems, may need hospitalization. Of those, majority have been elderly patients, patients who have other health problems like diabetes, heart disease, lung disease, anything else that affects their immunity.
So are the people who are at most risk the same folks who would be at most risk for most viruses that could pose a threat?
True. That's a very good summarization, yes.
So what are the symptoms of COVID-19 and coronavirus?
It seems to be very similar to flu in the sense people can have fever, tiredness, cough, runny nose, nasal congestion. People can go on to have worsening breathing difficulty with it. It's important to let your provider know if you have fever and worsening breathing difficulty and you have questions about whether you have been exposed to COVID-19. So call your provider and talk to them.
Let's go ahead and squeeze in our first break so we leave plenty of time because I want to get into how we can prevent this spread, what Mon Health is doing, and what we're doing here in West Virginia to prepare for, because it seems like it's a matter of time, not a matter of if, but when a case of coronavirus shows up here in West Virginia. So we'll continue the conversation. Dr. Greg Nelkamp joining us in the studio and Dr. Archana Vasudevan joining us as well. We'll be back after this on the Voice of Morgantown, WAJR. And joining us in studio today is Dr. Gregory Nelkamp and Dr. Archana Vasudevan. We're talking about the coronavirus, what it is, who's at risk, how it spreads. We were talking about symptoms before the break. By the way, neglected to say good morning to Sarah. Good morning, Sarah.
Morning, Dave.
Nice to see you over there.
Hey, you too, buddy.
Back to the matter at hand. We'll talk to you later. How does this virus spread, Dr. V?
So you can catch this infection from someone else who has COVID-19, usually transmitted by what's called droplets, little particles of water that catches the virus. When someone talks, coughs, or sneezes, these droplets can get expelled, and another person can either get them in their nose, mouth, inhale them into their lungs, or if these particles land on surfaces, they can touch the surface, get the virus on their hands, and touch their own nose, face, mouth, and thereby get the infection.
Same way that the flu gets spread around? I mean, it sounds like there's a lot of parallels here, at least on how it's spread, how you get it, and so on and so forth there.
Yeah, I agree. And that's why it's really important to wash your hands frequently and not touch your face.
So
Do we know how resilient this virus is? Because I know you're talking about things, maybe I was even joking about the microphones or the keyboards. Some viruses maybe would die more quickly than others. Do we know? Is this one that can stay on there for a week or?
It's hard to say just because this is so new and we don't have enough data on it to comment on how it will react in different temperatures and different surfaces, both hard and soft. But going by how previous coronaviruses have reacted, I would say anywhere from few hours to few days. And that's just estimating. I would say wipe down all commonly touched surfaces, wash your hands, and avoid touching your face.
And Dr. Nelkamp, we started to hit on it a little bit there. How do we prevent the spread? How do we try to prevent as best we can from contracting it and spreading it?
I think the best way to prevent illness is to avoid being exposed to the virus. Just some common everyday prevention actions. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you're sick. If you have to cough or sneeze, cover it with the tissue or the bend in your elbow, and then throw that tissue away at the closest receptacle. As we've said, wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating or preparing food, before cooking, after caring for others, and after blowing your nose, coughing, or sneezing. And if soap and water aren't available, you can use an alcohol-based sanitizer as long as it has at least 60% alcohol. But remember, if your hands are visibly dirty, you got to use soap and water.
How do I know if I should go be tested? Because the symptoms sound a lot, again, like flu symptoms, fever. How do I know that I should go get tested for coronavirus?
So the coronavirus symptoms, like I said, can cause cough, runny nose, fevers, body aches, nasal congestion, difficulty breathing. If you have had travel history in the last 14 days, or if someone that you know has recently traveled, or if you know someone who has recently tested positive for COVID-19, give your provider a call, talk to them, and they will guide you about how to get the testing done safely if you do need to get the testing done. People who live in communities within United States that are having higher levels of local transmission are also at risk. Those who are elderly, have other immunocompromise, heart disease, lung disease, also need to talk to their providers about if they are at risk and what to do.
You mentioned travel. WVU spring break is next week. What's your advice to students who, this is the time of year, you go to Panama City, you go to Daytona Beach. Where did we go on spring break? I mean, we didn't go on spring break together. Did you go on spring break, Sarah?
No.
Yeah, I didn't think so. So what's your advice to students who have travel plans next week? Should they go?
So it depends on where the travel itinerary takes you. There is widespread transmission going on in China, Japan, Iran, Italy, and South Korea. If possible, the recommendations are to avoid any non-essential travel. And as far as I know, the countries that don't have as much cases, they don't have restriction placed by CDC yet as far as travel, and your airline fares may not get refunded if that's the case. Protect yourself by avoiding traveling in crowded places, public transport systems, stay away from sick people, and after coming home, stay home for at least 14 days and talk to your providers about how best to protect yourself and your community. Those who are most vulnerable in the community need you to be safe as well.
Let's get in a break, and when we come back, we'll talk about what Mon Health is doing to deal with the situation. Also, myths and truths about coronavirus, including hoax cures. I want to get to that before the top of the hour. We'll also find out how Dr. V spent her spring break. We'll continue the conversation. Dr. Gregory Nelkamp joining us in the studio along with Dr. Archana Vasudevan. We'll continue the conversation coming up on the other side of this break. Two guests in studio this morning, Dr. Gregory Nelkamp, Senior Vice President for Clinical Affairs at Mon Health System, and Dr. Archana Vasudevan, an infectious disease physician and wound healing specialist at Mon Health Medical Center.
All right, we've talked a little bit about how this spreads, what the symptoms are, but we really need to talk now about treatment, and in particular, what is Mon Health doing to help make sure that we're prepared should we get, and I do want to clear this up. There have been no confirmed cases yet in Morgantown or even, as we know, in the state of West Virginia yet, correct?
Not as of last night. We don't have any cases. There are about 33 states that have confirmed positive cases of COVID-19, but none as of yet in West Virginia.
Okay, but if it does come, we want to know that there's good treatment out there. So what is Mon Health System doing to prepare for that?
I think Mon Health System is both very aware and very prepared for this situation. We're working closely with the Mon County Health Department in coordinating regional efforts and have been in contact with them since very early in February. Matter of fact, the Mon County Health Department is sponsoring a joint information center of which the Mon Health System is a part, which includes a wide variety of community stakeholders. I think that we are very informed about the situation. We have reviewed and confirmed our emergency plans and are communicating about the situation with our staff and making information available to our patients. We've taken a look and confirmed that all needed resources, both personal protective equipment and other, are in place and are ensuring that all of our staff have skill in their use. I think we are encouraging our sick people to stay home and enforcing appropriate isolation techniques and standards. And I think consistent with others, we're going to take a look at restricting visitors and, as always, separating patients with respiratory symptoms so they're not in contact with others. I think that, like everybody, we monitor this daily. We learn more daily. And we're aware, but prepared, but not at this point feel that we're ready.
It sounds counterintuitive, but at this point, if I'm a patient, I think maybe I've been exposed to it, maybe I've developed the respiratory systems, would you prefer that I stay home and not come into the clinic?
I think what we prefer you do is call first.
Okay.
I think that if you, are having respiratory symptoms and you've either been in close contact with a patient with known COVID-19 disease or exposure, or you've traveled to an area like China, South Korea, Japan, Italy, Iran, or any other that are identified in the future, we'd ask you to call first. The Mon Health System number is 304-285-3798. And at this point, we will, we want to talk to you. We'll do a brief screening, try to understand your risk profile. And then we'll create a time and a place where you can come in for evaluation in a way that protects staff and other patients.
And again, one of the things I wrote down, and then you said it, was restriction for visitors. If you're blessed and someone in your family has a baby, that doesn't mean you need to go see them in the hospital. Let's wait, especially if you have any of these symptoms. And in general, let's just try to, during this time of year, be extra cautious, right? We even talked about, I didn't shake hands whenever I came in with you guys today. Let's avoid some of these basic things. Let's just all agree that you won't be considered rude if you decide not to shake hands or not to visit or something in the hospital, right?
Totally agree with that. And this is really important because you mentioned about treatment. There is no vaccination or treatment as of yet for COVID-19. The treatment is more supportive, so depending upon what symptoms someone has, we would offer more supportive care. Some patients may need hospitalization or more help with their breathing, and that's why it's really important to reach out to your providers and discuss any questions or concerns you may have.
Got a couple of minutes left here before we let you run. How about some of the myths versus truths about COVID-19 and coronavirus? I see pictures on the news, people wearing masks. Does that help? What is that all about?
So people who have symptoms should wear a mask to prevent giving the infection to someone else. Like I said, droplets are how the infection gets transmitted. And if someone has any symptoms like cough or sneezing, wearing a mask helps prevent or at least lower the risk of transmitting this infection to others. If someone is taking care of a patient with similar symptoms, they should wear a mask as well to protect themselves. But the CDC recommends that people who don't have any symptoms do not need to wear a mask. We have a worldwide shortage of masks, and most masks that are available in the community are single-use masks and disposable. So I would recommend using the face masks very judiciously.
Got about 60 seconds here. It's springtime. Well, it's almost springtime. Flu season's going to be over soon, so that means coronavirus will be gone, right?
We don't have enough data on it yet because this one started in December, but there are a lot of other viruses whose activity sort of goes down in warmer weather. And some viruses are there that get more active in summer weather when people are outside together. It's hard to say, to be honest. We don't have enough data on it yet.
Will Grandma's old cough medicine work?
Supportive care, yes. If you have simple symptoms like cough, fevers, you can take over-the-counter medications like cough syrup and Tylenol to help cut down your symptoms.
That'll do it for today. Guys, very informative show. We got to have you back soon. Thank you very much for stopping by.